Thank you so much for speaking with us today. We worked on your headaches, and could you tell us what were your symptoms before you came here?
Sure. I had headaches for about 10 years, and they were maybe once or twice a month, and I treated it with just over-the-counter aspirin. I would take no more than 2 a day, and it would go away. And then I noticed past 4 years, the headaches were intensifying to become daily. And at the same time, about a year ago, in addition to the headaches, I also had this sense that I couldn't relax my upper body. Even if I envisioned or tried to meditate, I just couldn't relax my shoulders and just feel comfortable. And I noticed when I was driving, I had a hard time looking left and right, and that was a new symptom that I experienced. And that was about a year ago that those other symptoms occurred.
Okay. So, were you able to function with these headaches in the last year?
It was really difficult for me. As you know, I'm a vice president, and I've always worked my entire life in very stressful careers, and it's never bothered me. But the last year, I had a really difficult time at work. The pain was so intense at times that I didn't know if I had to take a leave of absence, if I'd have to. I didn't want to take higher medication. Regular aspirin wasn't working, so I was really afraid about working long term under this much pain that I was in.
Okay. What did you do to try to help yourself with these symptoms? Did you undergo any treatments?
Yes, I thought, my doctors thought it was sinus related, and I was very lucky that my ear, nose, and throat doctor had gone to a seminar on tension headaches and tension pain, and he saw right off the bat that the daily headaches that I was experiencing in the areas I was experiencing them was not related to my sinus. In fact, he did a sinus x-ray, which was clear, and he really recommended that I see a physical therapist that specialized in tension headaches.
Okay. So that was a great referral.
It was, yes.
Okay. So maybe you can explain what we've done and how it affected your life in general.
Yes, so I think the major thing that you were able to do for me is manually release the trigger points. So there's points in my body that were right here that impacted the headaches I was experiencing in my face. So that's really key, was you releasing those, and also explaining how my posture makes a difference throughout the day. So I'm known as a very calm person, but when I would type at work or I was under a lot of pressure, I would raise my shoulders and type, and it was the way I was carrying myself. So you helped me learn that to relax my shoulders, to take stock of myself throughout the day. It also was very important, even if you live in a busy life, to take breaks, to go to lunch. That seems obvious to some people, but when you're driven like me, I didn't think I had to. But at the end of the day, it was all that combination of manual release of the trigger points, the explanation and really taking inventory of how I carry myself, the exercises that you provided me to do as well, and then the meditation and hypnotherapy that we did. Everything just kind of came together, and it really, really helped me tremendously.
So how are you feeling right now?
I'm feeling like I haven't felt in 4 years. Like I'm not worried about my headaches. I know that I have a natural approach to take care of them, because I didn't like even taking aspirins. And I know what causes them now. It's not a mystery. I don't have some tumor. It was related to my whole body and how I carried my stress and how I interacted throughout the day. So I feel very, very hopeful. In fact, so hopeful that I want to get the message out there to other people how important and how vital this kind of therapy is for people that suffer from headaches as I did.